Okay, you're live.
We're live?
Mm-hmm. Yep, you're live.
Hello, everyone. Welcome back to O'Fallon. Again, my name's Ashley McFadden. I am the clinic manager at this location, and I have a special guest with me today. So we're starting to have our students help out as I pre-gamed you for last week. So I'm going to introduce you to Morgan Rundle. So she's from Mizzou, and she has been with me now for 6 weeks. So she's got 2 more weeks with me, and then she'll know everything in the world. We're supporting our schools a little bit today. So she's got Mizzou on, and I'm supporting Maryville University, where I graduated. So as we discussed last week, we talked about pre-op and the importance of pre-op therapy prior to a joint replacement. So last week we talked about the shoulder, and now this week we're going to move on into the knee. So the knee joint is a lot more commonly replaced. So you've probably heard of more of friends and families having it performed, and they've really perfected the procedure just in the last 10 years since I've been practicing, or 10 plus years. I'm up to 13 now. They've really perfected it, and patients are recovering so much quicker. But the pre-op therapy is what really helps them to have those awesome outcomes, experience less pain afterwards, and optimally get back to their prior level quicker. So we're seeing patients in the clinic even 2 days post-op, and they're doing really well. So the better condition that we can get your knee in prior to surgery, ultimately the better results we're going to get after. All right, so just a reminder from last week's discussion, you are probably experiencing some pain in your knee, and so we don't necessarily want any of these exercises to cause this pain to be any worse. So we're going to teach you exercises. There are ways that you can modify them so that you're not going to be in more pain. Our goal is ultimately we want to increase the range of motion in your knee. We want to get you stronger. We want to teach you to walk even better, and we want to help you manage the pain so that you can have those awesome outcomes after. So let's go over what we're going to discuss today. So my goals are to introduce you to some exercises that will allow you to go into surgery with improved knee range of motion and strength. We're going to demonstrate how you will use an assistive device after surgery. So we're going to teach you how you would walk with a walker. We're going to suggest some ideas for pain control, both preoperatively and post-op. And then we're going to discuss some equipment or supplies that you could potentially purchase to help you with your exercise program that we're going to teach you. And Morgan is going to help me to teach you the exercises and demonstrate all of them correctly. So we're going to start off with some knee range of motion exercises. So there's 2 motions in the knee, the bending or the flexing of the knee, and then the straightening or the extension of the knee. It's important that we gain as much motion as we can prior to surgery. So we're going to start with some range of motion exercises. Okay, first exercise is going to be called a heel prop. So you can use a large towel, or we have a foam roll here, just a little foam roll. A beach towel works really well, or I've even had patients use a coffee can to just help elevate their foot off the ground. So the foam roller is going under her ankle or her foot, her heel. And you can see we're just working on getting that full extension of the knee. So you should feel a gentle stretch through here. And I would recommend starting, if you can tolerate, a minute with that stretch. And we want to go through and do that at least 2 to 3 repetitions. If this is too high to start, you can always start with a smaller bath towel under the heel versus the more aggressive foam roller. So again, 1 minute hold, 2 to 3 repetitions. Okay, we're going to move into 2 different stretches for the back of your leg. So both your hamstring and your calf muscle. So increasing the flexibility in these muscles are going to ultimately help us to get that full straightening of your knee as well. So the first exercise we'll do is called a hamstring stretch. So Morgan's gonna lay on her back. She's looping the strap. This is called a stretch out strap. And she's trying to fully extend her knee, and her arms are doing the work here. So we want the muscles in her legs relaxed so they can get that ultimate stretch. And then we're going for a stretch right back here in her hamstring. So at home, you can use a belt, you can use a dog leash, you can use a towel, anything at home that can replicate this stretch. We do have the stretch out straps on CORA's website, and that's one of the most commonly purchased items that we sell in the clinic here. So she's holding for 30 seconds, and we're going to go through and do that at least 3 times, 3 to 5 repetitions. We're going to use this strap for one more stretch. This one's going to be for the calf, right? So she's putting the strap around her foot. So just make sure you don't put it too high up on your foot that strap slides off. And then again, she's going to relax her muscles and using her hands to pull her foot backwards. We're going for a stretch in the back of her calf now. And so with any stretching, we're holding for at least 30 seconds. And Morgan's going to go through and we'll do 3 to 5 repetitions when you're doing this at home. Perfect. We're going to keep this strap. So we've gone over 3 things that are going to help with getting that full knee extension back, or the straightening of the knee. Now we're going to move on into the bending motion. So first we're going to do heel slides. She's going to put something under her foot. We're using a towel here. At home, you don't necessarily, depending upon the surface, you may not need something under your foot. If you have a sock on, it'll slide just as well. Again, she's going to use her hands to assist with the motion. Good. So she's going up. When we get to the end range where she feels that gentle pull in her knee or stretch, she's going to hold it for a few seconds. And then she's going to lower back down. So again, her hands are assisting with this motion. With this exercise, we want to make sure she's holding for a few seconds at the end. And then we're going to ultimately try for 2 sets of 10 repetitions. If this exercise is a little too aggressive or you're having difficulty just getting that stretch in the knee or just a hard time pulling, you can either lay on your back and do the same exercise just so you're not stressing your low back while doing it. Or if there's not a lot of bending in your knee, so you're lacking quite a bit of knee flexion, what you can do is you can go up to a wall, and she's got the towel under her foot, and she's going to let her foot slide down the wall. And if need be, she can use the other leg to help straighten it back out. Good. So again, gentle stretch at the end, hold for a couple seconds, and she's going to do 2 sets of 10 repetitions. Awesome. A little more aggressive stretch for the knee to work on bending would be for your quadricep muscle. So we've gone over the muscles in the back of the leg, the hamstring and the calf. So to stretch out the muscle in the front of your leg, the quad, she could lay on her stomach. Not everyone can tolerate this before surgery, but it is an option. So she's going to loop this strap around her foot. At home, you can have someone assist with this just so you don't have any twisting of the knee when getting into position. Again, you can use the same stretch out strap, dog leash, belt, whatever you can find at home to replicate this. And she's going to pull until she feels that gentle stretch in the front of her thigh now. Like we've discussed, stretches are held for 30 seconds. And we'll perform it 3 to 5 repetitions. Awesome, Morgan. Okay, so we're going to move on. Those are all the knee range of motion exercises that we're going to focus on today that you can do preoperatively before your total knee replacement. So next we're going to go over some strengthening exercises. I like to incorporate some hip strengthening as well, so for your gluteal muscles. So again, you're having knee joint replaced, we're going to focus on quad strengthening, hamstring strengthening, and then we're going to incorporate some glute strengthening as well. So first exercise, we're going to stay at the table. She can do this one sitting or laying down. It's called a quad set. Good. Okay, so all she's doing, she's tightening her thigh muscle and pushing the back of her knee into the table. So this will hold for 2 to 3 seconds. And we can do more repetitions. So we'll do at least 20 repetitions. And as that gets easy, you can increase it to even 30 reps. So it's important that she's pushing with that thigh muscle and not compensating and using her gluteal muscles. So she would do that if she's laying down and trying to do it. We want to make sure you're just straightening. We don't want any twisting, trying to incorporate these muscles. Okay, next we're going to do a short arc quad. So she's going to get that foam roller we used before. She's going to put it behind her knee. And all she's going to do is she's going to kick her leg up. So back of the knee maintains contact on the foam roller. And then she's using that thigh muscle again, or your quad muscle, to kick her leg up. Just make sure this is performed nice and slowly. You're really focusing on using that thigh muscle as you kick your leg up. And with this one, I'd start with 2 sets of 10 repetitions. You can make it harder by adding a light ankle weight. Right here. Perfect. Okay, lastly, for the quad muscle at the table, she's going to lay on her back for this one. And it's called a straight leg raise. So she's going to bend her opposite knee. She's going to tighten that thigh muscle. And then she's going to lift her leg up until she gets even with the other leg. And then lower back down slowly. So the important part of every strengthening exercise is that it's controlled the whole time. So she wants to control it going up, and she wants to control the movement going down as well. So again, we'll start with 10 repetitions, 2 sets, and then you can progress that as it gets easy. That tiredness should be felt in the front of the thigh. Okay, at the table, another strengthening exercise, we'll move on into the gluteal muscles, or your gluteus medius. She's going to lay on her side. So we're working the right leg. Or I'm sorry, the right leg. She's laying on her left side. She can bend that bottom knee just for balance. She's keeping her leg in line with her body. Thigh muscle tight as well, and then just raising up in line with her body. So this is going to work those outer hip muscles. Good. You feeling it, Morgan? Yep. Good. So that would be a compensation where she went forward. So she's, like she said, just make sure your leg stays in line with your body. You're doing 10 repetitions. Rest for just a few seconds. I'd say 10 to 20 seconds, and then do another set of 10 reps. Great. Okay, we're going to have Morgan stand up now and demonstrate a few more exercises. So the first 2 are going to be for her hip muscles, and we're going to move over here so she can hold onto a surface while she's doing this, so you can easily perform this in the kitchen, at the counter, or we just want to make sure you're not bending forward while you're doing it, so you're keeping that good posture. She's going to first bring her leg out to the side. Good. So we're working those abductor muscles, or your gluteal muscles on the side. As she does it, we want to make sure she's not compensating by tilting her body or hiking her hip. So that would be going way too far. We don't need to go that far to get the tiredness that we want in the muscle. And again, with this, we're going to do 2 sets of 10 reps. If this were to get easy, we can easily add a resistance band around her knees or an ankle weight. So I'll show you the resistance band real quick. Okay, so again, into abduction, and we're doing 2 sets of 10 reps this way, and then the other direction we want you to work on is going backwards. So you're keeping that thigh muscle tight, but also now we're focusing on incorporating the gluteal muscle. So she's extending her leg, and she should feel it in those back glute muscles. Good. So show them a substitution, what you could do at home. If you were cheating or just substituting, trying to use the wrong muscles, she may catch herself overarching her back or leaning forward. So we want to make sure that you're conscious of those. And again, if you don't have a band at home, you could also use an ankle weight. Perfect. Okay, lastly, in this position, we're going to teach you a hamstring curl. So the hamstring muscles in the back of the thigh. We'll take that band off. And again, you can do this one standing at the counter. She's going to bend her knees. So we want to make sure your legs stay parallel. You're not forcing the movement, just go up in a controlled range. And you should feel that in the back of your thigh or your hamstring muscle. Again, with the strengthening exercises, we're going for more repetitions. So we're going for 10 reps, take a short break, and then do another set of 10. So 2 to 3 sets of 10 repetitions. And with this exercise, we can also put an ankle weight on to make it harder. Awesome. So like, so one other exercise that we want to incorporate for the arm. So it's important that you go in with strong arm muscles as well, because you're going to have to support yourself with the walker. So we're going to teach you one exercise. It's just a dip in the chair that will work your triceps muscles. That will help you to be able to support yourself with that walker or the assistive device that the doctor gives you. So she's sitting in the chair. Good. We can bend your knees. And then she's just going to raise herself up using those muscles in the back of her arms and then lower down slowly. And you can start with a small range. And then as it gets easy, of course, you can go a little lower. We don't want to go too low that you're stressing the knee, though. So just small dips in the chair. Feel the burn? Mm-hmm. Good job, Morgan. Okay, those are the exercises that we wanted to incorporate today for knee range of motion and strength prior to your knee replacement. We've also talked about the exercise for your triceps, why that's important to keep those tricep muscles strong as well, so that ultimately you can push yourself up better after surgery from the chair, and then you can also use your assistive device without any fear. So let's go through the equipment that we discussed that you'll need at home to perform these exercises. And like I mentioned before, all of these are on CORA's website, so coraphysicaltherapy.com, and they should all be tagged into this video as well. There's an icon at the top that says shop, and it's really easy and can be shipped directly to your house. So we went over a green stretch strap. So at home, you can also use a belt. Patients love this because you can alter, you can grip around the loop, and then you can alter your hand placement by what you need. We also went over using resistance bands or ankle weights. To make the exercises harder. Another option, it's important after these exercises, I would really use a cold pack. The cold pack is going to help to decrease muscle soreness, decrease any inflammation that you may have right now, and ultimately allow you to recover better after the exercises. That's something that's going to be great after surgery as well. It's really important in the first couple weeks that you're controlling the swelling to allow you to progress appropriately. So a cold pack is another great idea to purchase to help you both pre and post-operatively. And then lastly, a stim unit. So a portable stim unit is a great option to help with pain at home. Of course, you want to make sure it's appropriate for you and that you don't have any contraindications that would prevent you from using one. But those are also available on CORA's website. And if you were to use it at home, you'd want to surround your knee. So here's my knee right here. We'd want to put the 2 stim pads below the knee and then 2 stim pads above the knee. So we're surrounding that joint and then just trying to find a more soft tissue versus putting it on a bony landmark. Okay, lastly, we are going to teach you. So if the doctor prescribes you a walker, which is the most common, we want to make sure that you're fitted appropriately for that. So it's a good idea to have this in place before surgery versus just getting it at the hospital. So with it, this is fit for Morgan. So with her elbows slightly bent and her arms dropped at her side. So we want to make sure that's hitting at her crease. Oftentimes we see patients in the clinic and it's too high and they're shrugging their shoulders, or it's too low and they're slumping forward and ultimately stressing their back. So when she advances with this walker, so we'll say it's her right leg. That's the surgical leg. So she's advancing the walker, hitting with her heel, making sure her knee is straight and she's getting that full terminal knee extension. And then she's bending as she swings through. So that's something you can always practice prior to surgery as well to make you more comfortable and better prepared. Again, these are all, this is a suggested treatment program, pre-operative total knee replacement. They're just suggestions, and based on what I see patients progressing well with, it's always a good idea to be fully evaluated by a physical therapist in the clinic and get an individualized program for yourself. Please comment if you have any questions, but it's been awesome teaching you guys these exercises. I hope this helps you to recover quicker and ultimately have less pain afterwards. We have a special thing we do in the O'Fallon Clinic every day, so we will share it with you. We celebrate a national day every day of the year, and today is National Hot Dog Day, so go out there and have a hot dog. And it was fun talking with everyone, and thanks for letting Morgan.
MIZ.
Have a great day.